Dear students, let us discuss an image-based question in the upper limb. Now look at the image. What do you think it is? It's a bone. It's a bone of the upper limb. So what is that bone? Can you identify the bone? It's a scapula. And if it is the scapula, which side it is? And then what is the surface you are seeing in this picture? So that is the thing which you have to keep at the back of your mind when you are seeing a bone. And what is the surface? So if you look at this bone, it's a triangular bone and it has got 3 angles, 3 borders, 3 processes. That's how you remember. And it has got 2 surfaces. One is the dorsal surface, the other is the costal surface. The dorsal surface you can remember by looking at the spine of the scapula and its continuation, the acromion. So which you are not seeing on the surface. That means it is the costal surface. And then it has got the sharp medial border and superior border and thickened lateral border. And among the 3 angles, one of the angle is the broader, that is the lateral angle. And based on these points, you can identify this as the right scapula, and the surface which you are seeing is the costal surface. This is the costal surface. Now let us see the questions related to this surface. Now what is the muscle attached to this surface? And what is its origin or insertion? So what is it that is concerned to this bone and to this surface? And the bone that is you are seeing is the scapula and the costal surface, and the muscle that it gives attachment on this surface. Okay, this is the body of it. So on the costal surface it gives origin to a muscle known as the subscapularis. And once you know that this is the origin, where does it get inserted? It gets inserted into the humerus, the lesser tubercle of the humerus. That's how you have to remember a muscle, its origin and insertion. And next comes its nerve supply. It is supplied by the nerves from the posterior cord of brachial plexus, known as the upper and lower subscapular nerves. Then what is its action? So now you have to think about its action. So where is it getting inserted? It is getting inserted onto the lesser tubercle. And then what it will do? What is its action? So it will be adducting and medially rotating the arm. So that's the simple way to remember about this muscle. Now let us look at the next one. So what is that part? So from the introduction which I have given in brief, so this is the lateral one and this is the glenoid fossa or cavity, and to it the head of humerus is attached. So it is taking part in the formation of shoulder joint, and it will be having a glenoidal labrum attached around its margins, and this glenoidal labrum will deepen the concavity, because this glenoid fossa is shallow. So to fit the head of humerus, so it has to be deepened. So the glenoidal labrum is attached to it. So that is the glenoid angle it is called. And structures related to it or the glenoidal labrum which I have mentioned, and then there is the head of humerus which comes in contact with it. Then let us look at the third point. What is this border? So it is the lateral border, then which is a rounded one when compared to the other borders. Then what is the fourth one? So it is a thin and short border, and it is a medial border or vertebral border it is called. Then coming to the, what is that fifth one? And another point regarding this medial border is what muscle is attached around this border. So the muscle that is getting inserted along this border is the serratus anterior muscle, which has got 8 digitations. And what is its nerve supply? It is supplied by long thoracic nerve of Bell or Naruto serratus anterior, which arises from the roots of the brachial plexus. So what is its action? The action of the serratus anterior. So if you want to push somebody who is in front of you, you have to use your serratus anterior, and if you want to raise your hand above your head, or if you want to raise the shoulder above your head, you require the assistance of serratus anterior muscle. And what is its clinical importance? So you will not be able to do the overhead abduction and the pushing and punching movements, so if the muscle is paralyzed. That is the importance of the muscle attached to the medial border. Now let us complete the other components. So what is that border? So we have seen the lateral border, medial border. The third border that is remaining is the superior border. Then coming to the, we have seen the lateral angle or clinoid angle. And what is this? 1, which you will be seeing. This angle which you are seeing is the superior angle. Then what about the 7th point? It is the remaining angle. It is the inferior angle. Hope it is clear to you about the costal surface of scapula and some of the important muscles that are to be studied about this surface and the remaining borders and angles you have learnt. Now let us have a quick review of the subscapularis muscle, and now you know with the anatomical knowledge of attachment of muscles to the scapula. So it is arising from the subscapular fossa, medial 2/3 of it on the costal surface. You are seeing the origin of the muscle, and it gets inserted into the lesser tubercle of the humerus, and it is separated by the upper and lower subscapular nerves, which are coming from the posterior cord of brachial plexus. And you know that the branches of arising from the posterior cord of brachial plexus can be remembered as stars, S-T-A-R-S, the upper S and lower S, or remembering you to the subscapular nerves, upper and lower subscapular nerves, and then in between letters TAR for the thoracodorsal nerve, axillary nerve and radial nerve. Then what is the action of the subscapularis muscle? And I told you it's a medial rotator and adductor of the arm. So it gives strength to the shoulder joint in its stabilization, as it is part of the rotator cuff muscles, so which are the supraspinatus, infraspinatus, teres minor, and then this subscapularis. And if there is a tear of this tendon, which can happen when there is a anterior shoulder surgeries are there, And then there is the anterior shoulder dislocations are there because of a fall on outstretched arm in an abducted position, and the person will complain of anterior shoulder pain following external rotation injury. And then the subscapularis strain is more common in baseball players during the baseball swinging movement. Now let us see the tests for the subscapularis tendon integrity, and one is the lift-off test. So where you can see the person keeping his hand on his back in the midline, and then he should be able to move the arm away from the back. So you can see the dorsum of hand closing towards the back, and then you should move away from it. If the tendon is intact, subscapularis tendon is intact, he will be able to do it. Otherwise, he will not be able to do it. Then the bear hug is bringing the palm of one hand onto the opposite shoulder, and when the other person is trying to lift it off against resistance, he is able to press the opposite shoulder. If he is not able to do, means this subscapularis tendon on this side, that is the right side, is not intact. Then see here. So he is able to put the hand towards the belly, though there is resistance from the examiner. So if he is not able to put his hand onto the belly, or if he is not able to touch his belly or press the belly with the palm of his hand, then it indicates that the subscapularis tendon is not intact. So these are the three tests: lift off, bear hug and belly press tests that are used for testing the integrity of the subscapularis. Now let us look at the other muscle of importance which we have seen in relation with the scapula, that is the serratus anterior muscle. And what is its origin? It arises from the upper 8 ribs. And then where does it get inserted? It is inserted into the scapula, we have seen, along the medial border of costal surface. So from the 8 ribs means it is having 8 digitations, and these 8 digitations will be inserted along the medial border of the scapula, starting from the superior angle to the inferior angle, and nearly 4 slips they get inserted into the inferior angle of the scapula. And the nerve supply is the long thoracic nerve of bell or nerve to serratus anterior, which arises from the C5, C6, C7 nerve roots of the brachial plexus. And you can see that this is the serratus anterior muscle and this is the long thoracic nerve which you are seeing in this picture. This is the brachial plexus part, and the action of the serratus anterior is, as I told you, it is the protraction of the scapula, protraction forward movement, and then pushing and punching movements. These are the one that are possible with the intact serratus anterior, and the other one is a forward rotation of scapula or overhead abduction of the arm so that the glenoid faces laterally and upwards. Then the other action is elevation of the ribs. That is the other action of the serratus anterior. So it's an external respiratory muscle. Regarding the clinical importance of the serratus anterior muscle and the long thoracic nerve of bell that supplies the muscle, and you can see in this picture that muscle and the nerve, and if there is injury to this nerve and as it is passing through the scalenii muscles, so it can get compressed and it can result in paralysis of the serratus anterior muscle which it supplies. Then it produces a condition called winging of scapula. You are seeing the picture where the medial border and inferior angle of the scapula are prominent because there is paralysis of the serratus anterior muscle because of injury to the long thoracic nerve. Hope you have understood the scapula and the two important muscles and the nerves that are concerned with these two muscles, that is the subscapularis and serratus anterior muscles.